5:30. Leslie, you want to take the roll?
Sure. Josh Altum.
Here.
Chris Pugh.
Here.
Mayor Pro Tem Sandra Lee. She actually texted me and said that she was still trying to connect.
We're all trying to connect in one way or the other, Leslie.
Okay. Linda Rhodes.
Here.
And Chad Wandell.
Here.
Okay. Mayor, would you like to wait for Sandra or go ahead?
I'll wait for Sandra for a moment because I fear the wrath of Sandra if we get too started.
Deal.
I mean, just talking to Sandra, I'm always intimidated. I'm not going to wait too long, but we'll wait a little bit. So who's Kennedale Youth? Is that like Sonic Youth or what?
I believe it's Kelly at the library.
Oh, okay, good. There, Sandra, we're waiting for you because I told them that if we started, I would feel very intimidated if you came and talked to me about it. And I was saying, we're going to wait until Sandra gets on here. Because, you know, I have a lot of fear. So, all right. So let's get started. George.
Mr. Mayor, if you're ready, obviously this is a special meeting. The only item on the agenda tonight is to give the council an opportunity and the staff to interact with council regarding the budget. We've had a couple of work sessions on the budget thus far, and we don't have a formal presentation tonight, but I do appreciate the fact that council gave us a couple of extra days to put together some information that we are trying to accumulate. And I sent that to you this morning in the form of a spreadsheet. And essentially what it is a list of potential reductions to the budget if in fact the council wants to consider those reductions or a combination of reductions and tax rate increase that's been discussed thus far. I made mention in the memo that transmitted this spreadsheet to you that there's really not much room in our operating budget for cuts that don't have pretty dramatic impact on services that we provide. But we've provided this spreadsheet and these numbers that are hopefully a point of departure for your discussion tonight. I also included in that transmission to you this morning a copy of some estimates that the fire department has made with regard to ambulance service, since we've had some discussion about the potential to outsource our ambulance service. You'll note from that information that I provide to you that there really, as it turns out, is not a lot of savings to be recognized if in fact we made the decision to discontinue providing EMS service through our fire department and tried to outsource that to a third party. We obviously wouldn't have exact numbers until we did some additional refinement, but I think the savings would probably not measure up to the potential loss of service to the community if we had a third party providing the service, particularly in the sense that we might have some lost response times, but more importantly, we're pretty confident that the rate that would be charged to citizens in the community if they use the ambulance service would be greater than are the costs and charges that the city is currently charging for that ambulance service. So you've been given and that ambulance outsourcing is not included on the spreadsheet of other potential reductions in service, but it's provided to you so that you do have the cost estimates that the fire department has made. And again, I'll point out that that only includes the financial impact to the city's budget. It does not take into consideration any service changes that would be made in the EMS service. I've also pointed out that if in fact you make the decision to continue providing EMS the way we have for a long time, that we've recommended some options and a recommendation for how to fund a new ambulance that we're in need of, as well as some other fire apparatus going forward. So,
Well, George, let's bring this up because Chad and I and you had a little brief conversation about this. And I suggested that, maybe we need to get a consensus of the council. Is the council interested in looking at a third-party service? Should we be going out for RFPs just to see what's out there, to see what kind of information, because there's MedStar, Chad knows there's AMR. Is there any consensus on the council that you'd like to go look at a third party? And I'll start off with Josh because he's at the top of my screen. Josh, thoughts? You're a firefighter.
Absolutely not. It's a disservice to the citizens of Kennedale to do something like that. I'll wait to see what everybody else says before I give my remarks, because I might be just wasting my breath. So,
Well, Josh, I'd like to know because, and I've said this before to you, you're an expert in this field. You work in it, and I'd like to hear why you think no.
well, first, George had some great points as far as the details of what would happen if we did go to a private ambulance. I want to hit the point here that, last year we went to a different billing company, so we don't have those numbers coming in yet, which supposedly is supposed to increase our revenue 20%. But as far as the actual going to a private ambulance service, they're in the business to make money, and that's all they're in the business for. You're jeopardizing patient care. There's so many different things you jeopardize when you do that. If we did go to a private service, I can guarantee they wouldn't hold an ambulance in our city. They would be outside our city limits, so our response times would definitely increase. All the firemen in Kennedale would drop their paramedic certs, or anybody we hire would become EMTs. So if your mother or father had a heart attack, they would get on scene and be twiddling their thumbs because they can't really do much until the paramedics on the ambulance get there. So that's another disservice. And just whenever you have a fire department based EMS, you just have more control and just better patient quality. Altogether, when you look at the numbers, we're only saving roughly around $30,000. So is that worth jeopardizing your family member for saving $30,000? I don't think so. And if anybody has any questions for me, I could answer. Let me look at my list here. Another thing too with private service, so to make up for the cost, so say they come and give us a low bid, that's all good and fine, but whenever your family member gets transported, to make up for those costs, your ambulance bill is going to be skyrocketed. When they use gloves, needles, they give it medication, it's going to be almost 2-3 times as expensive as if Kennedale was to do that. So altogether, me personally, it's just they don't get the training that firemen get. And I just think, like I said, it's a disservice to the citizens of Kennedale or anybody, any patron passing through Kennedale, to be transported by a private service.
Well, then let me go over to Chad. Chad, you did some research on this about what's out there. What's the counterpoint here?
Well, you can say it's a disservice, but Arlington uses the service. Dallas uses the service. Their response times are better than ours. Most of the people that work for AMR are actually firefighters working another shift around, so they're already firefighters. They are, Josh. I know most of the employees that work there. My wife was the scheduler for AMR for years. So I'm familiar with the service. You say that the cost of the ambulance service would skyrocket. Well, if you look at it, the counterpoint to that is, well, we're subsidizing those costs by higher taxes. So we either all pay for it or the person who needs it pays for it. You can go either way on those. So, and as far as the cost savings, I think they're higher than what we're looking at. But that's just my point of view. I mean, how's our helicopter service here? None. AMR would provide a helicopter service. If you needed to be care flight, you wouldn't have to wait on care flight.
AMR does not have does not have a helicopter.
Who's
Yeah,
that?
they do. I talked to them. They have 55 of them here in the North Texas region.
Who's that?
Steve Brown. AMR does not have a helicopter. They use Care Flight. They use PHI. Those are the air ambulances that they use. Same ones that we have access to as well.
Okay. And do we do triage with people on the phone if they don't need emergency medical services? Do we do anything for those people? I mean,
Repeat that. I'm sorry.
do we do any kind of, you don't need an ambulance right now, but we'll send you we'll put a registered nurse or a nurse practitioner on the phone with you to do triage, and then we can have Lyft come pick you up and take you to a medical provider. That's a service they do.
Well, let's make clear that we're talking to Fire Chief James Brown. We don't have a picture of him. So
That is correct.
I mean, I'm just saying, I think in the crisis that we're in, all options are on the table. I mean, if we're not willing to look at where some places we're gonna have to do some deep cuts, then what are we even having the conversations for?
So Chad, you're not saying go with it. You're just saying that
I'm saying we need to
should
at least get a real look at what it's going to cost and do and the services that it can provide and the options that are out there for it. Because where else are we going to get the kind of money we're talking about? Because even with the 80 cents big tax hike all the way to that number, we're not talking about employees getting raises every year. We're not talking about firefighters getting their raises every year. So we're basically flat and going downhill still. It's duct tape over a hole in a boat. So either we have to do something drastic or this is all moot.
So John, Chad, you're arguing just to do the RFP, see what's out there.
Yep. I mean, that's at least step one. If they come back and they say, yeah, we can only save you 30 grand, then no, I'll be glad to write my check for the higher taxes if we don't get any savings out of this. But I think with the situation that we're in, it is a disservice to our citizens not to explore it.
All right. Chris, your thoughts? You're right next to Chad over here. So
I'm going to agree with Chad. The RFP is minimal cost to us. I guess it's some staff time. I think I'd like to see what's out there, and I would like to have Chief Brown analyze it, obviously. I'd like to see Lakita's analysis financially, and then I'd like for us to discuss it because I'm with Chad. If it's a minimal savings or if it's to Josh's point, if it's going to double our response time, then it's not worth it. But I think it's worth seeing what's out there because the cost of that, I believe, is going to be minimal. Maybe there's a benefit, maybe not. But if we don't look, then we won't know. And I'd rather we make an educated decision and let the chiefs take a look at it and come back and visit it. We're going to obviously have to pass this budget prior to having that information. But that doesn't mean this can't be something that we have on our radar to look at once the budget process has gone through. And if we don't like what we see, then we pass on it and continue on like we are and look at funding the equipment that's needed to keep our service at 100%.
Linda, your thoughts?
I'm not a fan of outsourcing the ambulance service. However, on the other side, it doesn't hurt to get information. But I'm just not a fan of not having our own service. I think that would be jeopardizing our citizens' safety.
All right, Sandra, that's so far 2-2 sort of. Where are you at on this thing?
I'm with Josh. We outsource water, we outsource jail. I mean, what kind of city are we that we continue to outsource our departments? And I understand what Chad and Chris are saying, but at some point, we just have to dig in and make the hard decisions and keep our fire department within the city. That's my 2 cents.
Would any of you be in absolutely 100% opposed to compromising and just say, let's just do an RFP and just see what's out there, but we're still in favor of having our own ambulance service?
That's fine.
Linda?
I think it's a waste of resources because it's going to take time to get something like that together as far as transport times and all that good stuff.
Well, let's, Chief, what do you think? Unmute, Chief.
You ask me, is that what, I missed it, I'm sorry.
Yeah, yeah. Quit watching TV. Would it hurt just to do an RFP at some point? Does that hurt, or do you think that's going to take up too much time and resources, or what?
It would never hurt to do the RFP. You're talking about creating the RFP, putting it out. I think it has to be advertised for 45 days. Lakita could probably help me with that time frame to evaluate it. You know, one thing that they can't tell us, even on an RFP side, and it depends on how you formulate the RFP itself. There's a lot of ways that you can create it. But as far as comparison of costs, they don't know what our costs are. You know, we've given pretty good cost evaluation for what it is up to date. And I don't think that those costs have been looked at very well anyway. So RFP we can do, we're talking about probably 3 months to complete it, you know, 2 to 3 months to get it completed.
But James, if they don't know our cost, isn't that advantage to us?
Like I said, it depends on what, if you're going to say, okay, if you want to give typical cost evaluations, okay, so for a cardiac arrest, and here's the criteria, what's that going to cost the citizen? I don't know if you're wanting to go in depth what that looks like. You know, obviously you would want to secure response times. You're going to want to secure, that's our biggest deal, what those response times are to help with our citizens. Are they going to staff us? Are we going to be at staffed with an ambulance 100% of the time? Do we put a criteria 75% of the time, 50% of the time? It just depends on how we create that RFP.
And James, every 30 seconds in a heart attack does what in a delay?
It's tissue death. You know, and when I say tissue, that's heart death, you know. Delay is key in, you know, in a cardiac arrest, that's for sure.
So even if we were to do an RFP, this budget would include then our own ambulance service, because it would really be for next year if we wanted to look at replacing the ambulance service.
Yes, it would be.
Other thoughts, Chad? What are you thinking?
I'm just thinking, you know, I heard last meeting people say they want to keep the effective rate, but all I got to say to that is if you want to keep the effective rate, we need $1 million. We need $1 million year over year, not this chump change that we're talking about, nickels and dimes. That's one-time cuts where we're here doing this again next year going, all right, let's find another $300,000 of stuff we don't even have $300,000 of. So come up with $1 million and I'm all about it.
Yeah, I think there's an issue that when you close the library, that doesn't reopen because the money doesn't come back next year. Right?
Well,
that's what you're saying.
Same way with.
Well, I don't want to close the library at all. I think that's a valuable resource, especially right now with people that are out there job hunting and trying to keep their lives together.
I guess what I'm saying is that any tax cut, or any spending cut, it's going to be a permanent thing.
It's a permanent thing until the budget situation flips around and our sales tax scenario isn't, you know, what it is, where we're getting the same kind of sales tax as we're getting in the property tax. So the burden isn't solely on us taxpayers.
Right.
So until that starts to happen, yeah, it's a permanent cut.
Well, you also say too about outsourcing the ambulance, that's a temporary thing. That's not a temporary thing. Once you outsource the ambulance, we would never get it back. It'd be too difficult for us to take it back over because of what we have to go through.
Yeah, I think it'd be difficult to bring it back just because once you eliminate that cost, it's easy just to keep that cost off the books. I don't think it would come back either, Josh. I think that would be it.
But let me just be honest and blunt with you here. Like, I've been a fireman for almost 22 years, and I think I know what I'm talking about when we're talking on the subject, it would be a horrible, absolute horrible idea to go with the private service. Like I said, they're here just to make money. They don't care about you or your mother or your father when they go pick you up.
All right, well, I'm going to talk on that point then. So when I first moved to this city 4 years ago, my mom was in a car wreck.
Hey guys,
right
I
down
gotta
the
run.
road.
Hold on a second, Chad. I think we're losing Josh. He's got to go to a run.
All right.
Okay, we lost
My
Josh.
mom was
Go
in a
ahead, Chad.
car wreck 4 years ago, right on Sublet Road, right as you come into the city of Kennedale. And I sat there watching my mom sitting on a cot while Kennedale argued with Arlington about not wanting to take her. Where's the service in that scenario? Arlington wound up taking her off Kennedale's cot, putting it on their cot, and taking her to the hospital.
Well, that is
So let me ask you something on that. So where at on Sublet was this? Where was it at?
Right as you get to the top of the hill and you come right over the top of the hill. The car was clearly on the Kennedale side.
Okay, so sometimes both agencies will get calls depending on what area you're in, just because it'll hit whatever signal or tower.
Mm-hmm.
And-
And I understand that, but
Right.
Arlington was on scene first, but then Kennedale was like, no, they're like, well, if she's in your town, so you guys should take her then. And they're like, no, we don't want to do that. If you guys were here first, you beat us to the call. Take her. And they
Had
literally sat there
AMR
for
already
3 minutes.
initiated care?
Do what?
Had AMR already initiated care?
I don't know. I mean, I guess that goes to response times. They beat us there.
That's not what I asked, sir. I asked if they had started care on your mother.
She was sitting on the cot. I mean, as far as care goes, they were just going, are you okay? Can you hear us? Can you see my fingers?
There are certain rules by the Texas Department of State Health Services that discusses treatment, initiation of care, and transfer of care. It was 4 years ago. I was not employed with the city, and I don't know what transpired at that time.
And I understand. It's just, I'm bringing this up as a counterpoint to they're just in it for profit and they don't care about you. Well, I mean, if that was the scenario, then they would have said, get the hell out of our way. We're taking this woman to the hospital so we can have the trip charge.
Well, I think we're going to get back to, is the council comfortable with doing an RFP? It wouldn't affect this year, obviously. Is the council comfortable at least going out and doing an RFP? Chad?
I think it needs to be done. Otherwise, like I said, find us $1 million.
Chris?
If the chief is not opposed to it, then I think it's at least worth gathering the information.
Linda?
Again, I take my same stance. I mean, I'm not a fan of getting rid of our ambulance service, but information is always good to have.
Okay. And Sandra? You're on mute, Sandra.
Yes, we can go ahead and do it, but I'm just so y'all know, I'm still voting to keep our fire department.
And so I think that would be in the budget for this year. That's not a problem. All right, is everybody happy with that sort of compromise? We go at least take a look, see what's out there. All right, George, go on.
I mean, hold on for a second. I mean, this is going to cost the city time and money. If there are 3 people on our city council that doesn't care what's going to come back on this RFP that are going to vote against it, then why waste the money?
Well, it's possible that when you see the information, I don't think that Linda, Sandra, Josh are closed-minded enough that if they saw something that was going to be effective and useful and save us a lot of money, that they would at least consider it. I don't think that any of those people are that closed-minded to say, I'm 100% here, show me something better, and I might be able to go that route. But show me something that's not going to be better, or it's not saving us a lot of money, then I'm going to go with, I think if I'm putting words in your mouth, let me know. I'm going to go with what we know and what we've had tried and true.
I just want to make sure, because Sandra did just say.
I did just say that, and what I can say, and I understand what you're saying, Chad, about 4 years ago, but I think our fire department and our police department have improved.
I agree with that.
And so unless it's going to save us money, I'm just letting you know that I'm voting to keep our fire department. So, you know, I'm just letting the people know, don't call me with questions, because I'm already telling you that I'm going to support our fire department.
And I want to support our fire department and everything, but when it comes down to it, the increases that I've already had on the value of my home plus this, I'm literally one more tax cycle from selling my home to downsides because I can't afford the damn thing.
Well, but I think Linda just said, unless she saw, or Sandra just said, if she saw some big savings, big savings, she'd consider it. And Linda, are you the same way? If you saw big savings, that you would at least consider it?
I'm probably a hard sell.
Yeah, okay.
Because I don't, you know, I'm just not a big fan of outsourcing a lot of different things. You know how I felt about the water sewer. When you do that, you lose a certain amount of control and say, and just like the water and sewer, you know, whenever we were going through all, it was said that, well, if it doesn't work out, then we can always go back, but it's always harder to go back. And usually that never happens either. And if we outsourced or went to another company for our ambulance and it didn't work out, that's pretty big.
Well, it also depends on what our budget looks like next year.
Right. Yeah.
Right. And so if we don't have the information for next year, then we're stuck again, as I would say, another 3 months of doing it. Why not at least just get the information and mull over it? And if we say no, we say no, that's fine.
Worst case scenario, you have the information on hand for next year's budget to go, well, this is a much bigger option than it is now, but at least you have a basis to start that decision-making process.
Yeah, and we'd have that basis, Chad, in 3 months.
And we could have a different council then too.
Yeah, we could have a different council by then. Sandra could be gone. Better job, Sandra. I could be gone. More vacation time. Chris could be gone. More drinking time. There's just a lot of things that could be happening in the next few months. So I think we want to go ahead and just do the RFP, George.
That's fine, Mayor. And as James was saying earlier, just preparing the RFP is going to take some time because all of the issues, the response times, the rates they charge, their availability, where ambulances would be stationed, all of those are the kinds of things that you can put in your RFP and expect a response and a contract that would protect the city in those instances, including response time. So it'll take a while to be sure we include all of those issues that we need to cover, but we'll begin working on an RFP. And as you said, it will not be something that will be back in front of this council probably for at least 3 to 4 months.
So when we talk about the RFP, how many different types of questions are we going to be asking? Because I don't know. I don't do that.
I don't know that I can answer that either because we're not inventing the wheel here. There are a lot of communities that have ambulance services that are contracted out. I think Josh pointed that out, or somebody did. Arlington and Fort Worth have different services that they use. But my experience is you build a lot of things into a contract for ambulance service that helps protect the city, and it can require that you guarantee certain response times, that the council can retain certain control over the rates that are charged. There might be an opportunity for the city to fund some money to subsidize the service, even if we're not providing it, and help keep patient rates down. Those are all the kinds of issues that we want to be sure we've at least thought about before we start asking for RFPs and then evaluating those one against the other. And it's the ambulance and EMS service, as Brian or James can tell you, is a very complex service that we provided. And it's a very critical one because of the fact that it's treating our citizens with medical service. So again, if the consensus of the council is that you want to do an RFP, I think it'd be probably wise to assume you won't know the answer to how that would, the outcome of that, at least until mid-year this year. And then you've got to determine how those proposals will impact next year's budget. So we'll get started on it if I'm hearing that as a consensus of the council to get the information.
Yeah, it's a rough consensus, but it's there.
Okay. All right. Mayor, again, we don't have a presentation. We're willing and able, and then we have the staff here, I think, to try to respond to any of the items that are on that spreadsheet list that I gave you. I am recommending to you that you obviously the council has already acted on our insurance for next year, and we've recognized some savings there since you adopted that last week. We got a best and final offer, and the money that's built into this budget for a 6% increase in our health insurance costs can now be taken out of the budget, or we'll have savings there that can go into the fund balance. We are recommending, obviously, you already approved the rate, the new insurance coverage. We're also recommending that we consider changes in how the senior center is managed, and I will make a comment about that. We've had discussion with 60 and better. We've had discussions with the board of the seniors here at the center. We're operating in a situation where the center is not open now, and we can't open it. But the intent would be to transfer the programming for our seniors over to and utilize the asset that we have in the library staff. And in a lot of discussions that Amanda and Melissa and I and 60 and better and the board members have all had, I think there's a likelihood and an expectation that in fact we can significantly enhance the programming that's now being done at the senior center and provide better opportunities and recruit more seniors into the programs if we can improve those programs, even if we're trying to do some of it virtually, because we, just like 60 and better, can't do it in person, but at the center yet. But we'd also like to look at how the meals are prepared. Can we get back to 5 hot meals a day rather than what's being provided now? And in all of the discussions, we think that's possible. And the $20,000 that's represented on that spreadsheet is essentially the contract with 60 and better. But we're going to utilize our existing assets in the library to do that enhanced programming. And we'll still be able to provide, when time and the pandemic circumstances allow us, we have the vehicle for doing the trips that the seniors are now taking. So we really do believe that the seniors in the community are going to benefit if the council accepts and lets us cancel the contract with 60 and better and provide those services ourselves. So we recommend both the health insurance reduction in cost and the senior center. And beyond that, the list is open for discussion, because a lot of that on that list that is significant dollars at all is personnel. And I'm certainly not presenting this list to you as a recommendation to cut these items from the budget, because I don't believe that doing that is in the best interest of service to this community. But we're here to talk about it. And if you'd like to ask any of the staff members questions about anything on this list, then feel free to do that. I've itemized on the list that only about $190,000 of that $600,000 that's listed is non-personnel related, and some of that will, if it's cut, will significantly diminish services to the community as well. So that, I'll quit talking and we'll respond.
Can you take us through the non-highlighted stuff that's not employees and just tell us kind of what it is and why it's on the list?
Well, let me tell you in general terms. For instance, one of the next things after those items in green that I've recommended is, and based on comments that council made at our last meeting, have we scrubbed and scrutinized the budget? And I think Lakita's answer to that last week was exactly on target. We have looked at every line item, but we've gone back on the assumption that there's still an interest on council to reduce the tax rate to the no new revenue rate. Where would we have to go? And those items that are not in orange on that list are what I would consider to be discretionary in the sense that they're not required by a legal contract. Most of them, and I'll talk about that in a minute. Most of them
George,
are not.
George, let me ask you, George, let me can people see this chart that we have up here?
I think they can.
Or is it pixelated for everybody?
I'm sorry?
Or is everybody seeing pixelated? Or is everybody else be able to read what this chart says?
It looks good to me.
Leslie's put it up. I can see it very clearly.
I put it up.
Oh,
It
you
looks
put it up.
good.
Okay. I was just saying, because I had a text that said it was pixelated, and I wanted to make sure that people could see this chart.
Well, I
Hey,
hope,
you might want to scroll up a little bit because you're farther down in the chart and there's things that, yeah.
all right, let me just talk about some of these things at a high level to begin with, and then we can get to question. For instance, the item under the green lines, the two I've already recommended. I went through every department of the general fund and scrutinized and then shared with the department heads any kind of item that's in there for travel, training, or dues to professional organizations or city organizations, such as the Texas Municipal League and so forth, to try to determine what is not a legal obligation of the city to provide, or what is not required for our employees to maintain their professional certifications, qualifications to do their job, etc. But it would, that $23,000 would essentially say to the whole organization, there will be no travel, no training that is not absolutely required by law or by certification, etc. Some exceptions to that, but the reductions that total that amount of money come from every general fund department, including the mayor and council's budget, and range from $4,800 to $500 in the police department. Public safety was included in the examination. So that's what that money is. And again, it's not, given the size of our budget and what we try to provide to the service, I can't recommend that you take this out, because we've done this in the past 3 years as well. And many of our employees simply are not getting the professional training they need to be getting. Special services in the city manager's office is $5,000 that's on the list. Just, it was included in the budget because for the last several years, historically, in mid-year, we've had to go out and do a special study for compensation comparisons in order to make reasonable adjustments in our compensation plan, or we've done an engineering study of flooding in a neighborhood. That's a small amount of money, but the idea that we would go through this entire year without having some kind of a challenge like that we just can't anticipate, but this would cut that money and the availability out, so I wouldn't have anywhere to go for that necessarily. Special events in the mayor and council's budget is all of the special events like the Pumpkin Palooza and all of those special events that we enjoy and provide some seed money for in the community. I don't know, I have all the detail, or I can't remember it, but it includes things that activities with the Youth Advisory Council and other things that we kind of pride ourselves on for being able to provide to the community. So building maintenance at City Hall.
Wait, George, special events means no trunk or treat and no tree lighting.
That's correct. Well, that's included in that,
right?
In that $12,500. All of those things are included in there. So you could take a piece of it and leave a piece of it. But doing that with these small amounts of money, again, I'm saying to you, is not going to cure the problem we're trying to address right now. Building maintenance that you see with the red notes on the side, that's an area where frankly that's building maintenance and cleaning for all of the city's buildings. Clearly we could reduce some of that because we don't have as much activity in the buildings right now because of COVID. But City Hall, for instance, we still have to maintain the buildings. We still have employees in here every day. That's an amount of money that we could cut, except that I've got to go back and finish reviewing contracts, if you want to do that, council has approved contracts, for instance, for cleaning at the library and the police station and the city hall. So if we tried to reduce that money, I've got to determine whether or not we have the latitude in our contracts to do that.
George, and is this a time to reduce cleaning during a pandemic?
Well, absolutely not, because even if it's employees only in the building, City Hall, as an example, we're being very careful, buying more supplies. The fire department has been able to put together some disinfecting spraying equipment that we are using in the buildings, again, to protect our employees. And once the buildings are open to the public and the police department hasn't changed its operation. So they're still the same kind of operation with regard to the public or the employees in that building.
And do we see COVID funding maybe increase, that we could use that during the next year?
Well, I don't know the answer to that. Right now, the COVID funding we've got needs to be spent by December 31st, and some of these things could be used to allay some of those costs, and that we're using them for that. But right now, that doesn't go past December 31st. So legal services is an arbitrary reduction in that, and you all know as well as I do how if in fact we made that reduction or cut to the budget and we had a need for the service, we'd simply have to come back to you and appropriate it. So I don't think it's a particularly wise expenditure to just cut arbitrarily. Splash pad remaining closed for all of next summer. There are some savings. Most of that is the cost of water. Employee appreciation dinner and recognition. Some of that are things that we just started last year in support of and trying to maintain and keep the good employees that we have. So it's a small amount of money, but it is an area that could be reduced if the council wanted to do it. Building, again, I already mentioned building maintenance, even in the library. Book purchases at the library. That's a number that obviously when you start reducing the material that you have in the library, it can become outdated. I'm sure Amanda could tell you what we go through on a regular basis to weed the library collections and get materials that are either not ever checked out, but there has to be some commitment to continually renewing material in the library, or it can quickly become just not as useful to the community as we would like it to be.
Amanda, question is that if we're talking about, and really $5,000 is just a drop in the budget, and I don't believe that every little bit helps because there's a structural problem here, obviously. How many books do we buy a year? And are these books, you know, even if you said, well, let's get rid of the 5,000, can they get the books from other libraries?
So I think that we purchase around 1,400 to 1,500 books per year, and we weed on a 1-to-1 ratio. Now, the average hardback book costs about $25 for the library, and that's with our discounts. So, and then in addition to that, we have digital resources we have to purchase and databases and things like that. Yes, people could technically get those items probably through either interlibrary loan for the time being, or possibly through one of the consortium member libraries. But I will tell you that our book budget is less than 10% of the library's budget, and that is low for Texas as far as recommended amounts that they want you to spend on your book budget to begin with. So we can handle it this year, but we can't continue to cut in that area long term. Like we can't year over year continue to cut the book budget.
Now, this $5,000 is not all of the book budget for this proposed budget, but it would be a substantial reduction.
The book budget is about $25,000 at the moment, and so y'all can do the math as to how much of a cut that is to the book budget.
Yeah, I skipped one of the special services and community development. You all are aware that we decided last year not to replace an employee who left, but instead contract out building inspection services and other services. And this would be somewhat of an arbitrary reduction in that. And if we had plans review that needed to be done, and or building inspections, then we would simply have to come back to council if we have cut too deep there to commit that contract. And with that money in the budget, we're still saving a substantial amount over what we were spending when we were trying to do all of those functions in-house with one employee. So the other items that are not personnel, the employee assistance program, not very expensive at this point. We began providing that last year. You'll remember that came up during our planning session last summer, and we implemented it this past year. It's gotten some use as I understand it, and although I can't give you the details on that, and if I knew them, I couldn't tell you anyway, but EA, employee assistance, is a very important part of what we provide to our employees. The furlough of every employee for 1 day during the year would be about $14,500. I clearly do not recommend that, but the council did have discussion about that as a possibility, so it's included on this list. Everything else on that list is directly related to eliminating an employee position, either part-time or full-time, that will have a direct diminution in service delivery to the public. So Chad, does that kind of summarize it the way you wanted?
Yeah, I just wanted to kind of have a rundown of what was in all those groupings and stuff like that. I will say right off the bat, the only downfall to seeing this list is it's one time. These are all one-time costs. And I think that's where, you know, I have to give kudos to you and the staff is there's not a lot here to cut away. And there's some of it that I wouldn't cut. Like, no way I'm giving up our employee assistance program. I agree. There's no point in furloughing everybody for a day because whether they work or not, we still, there's not really any savings there. I hate to see us lose our special events and things like that because I think that's what builds our community spirit and keeps our community as tight knit as it is. So there's really, you know, again, this is what I talked about when I said nickels and dimes. Here's
Chad, some that you just said, and the directors and I have had some discussion about this in the last week, and the public safety director, police and fire chiefs, and Brian, we all recognize that it's easy to say, go where you have discretionary cuts and cut the budget, but don't cut anything in police and don't cut anything in fire. And that's just the way things are. But the community is made up of a lot of other things, and how we keep the rights of way mode, how we maintain our park system, what we can do in the library, those programs that we put on in the park when you're down here, and all of you have been when the park here at Central, at Town Center is packed with people and the community is enjoying those. Those are all parts of what make a community livable and likable and fun and a quality place to live. And it's not just all how many uniformed police officers do we see and how many uniformed fire officers do we see. And so we've had those discussions in not just this year, but last year as we were making cuts in these services as well. And so you made a point. These items, again, are not things that I can in good conscience recommend the council cut to either reduce the budget or to improve the fund balance. And there's not very much there to do either of those things anyway, so other than the personnel.
Yeah, and I'm looking at things like, okay, so special events, those are things that I would rather leave in the budget. And if the COVID situation says, well, we can't have trunk or treat, okay, we didn't spend the money.
No question about it. And there are some other things. That small amount of money that's in there that's cutting out all the travel and all of the professional training. If, for instance, an employee can't go to that training because those events can't be held because of COVID, that money will then improve the fund balance because we're not going to spend it.
But I see that scenario with a lot of these too. Of, you know, Well, you could leave it in the budget, and if COVID says I don't think so, then no harm, no foul. Like even the splash pad. I mean, we could be looking at this stupid thing all the way through next year, but I don't know. So it's things like that that I would rather leave it in the budget and then come around to and go, well, can't open that this year.
Yeah, I'm with Chad on this. I don't think we'll have trunk or treat. I don't think we'll have the Christmas tree lighting. It's just too many people in an area right now, and we're not going to see a vaccine until maybe January.
So, but I would rather leave it in there just in case because to me, those are big things. Those are the things that people come together. We get to put faces to names. We get to build the community rapport. And those are honestly things I'd rather leave in the budget and just not use. But
And if we don't spend them, they go into the fund balance. Sandra?
It doesn't help the bottom line look. So, I mean, it's kind of like you're damned if you do, you're damned if you don't.
Right. Sandra, what are you thinking?
Well, I noticed we have the liquor store coming in. Do we have any more businesses that's coming in anytime soon, Melissa?
In terms of retail, I'm not aware of any retail. Of course, we're working with a company who wants to expand business, and we're working with them to move potentially to the location that EDC owns on Linda Road. But, you know, we've got an issue with Linda Road. But, you know, I think one of the challenges with retail that we have is we need places for retail to actually go. And that doesn't happen overnight. And so if retail doesn't have, you know, buildings and infrastructure to go into, retail isn't going to come. So it's rare for retail to come in, build their own individual building. So one of the things that, of course, as you know, we're working on is the mixed-use urban villages and the development on Kennedale Parkway, complete streets. But these are things that take time to develop.
And Linda, just to clarify, the liquor store, that was already zone commercial. It was under the schedule of usage, so it didn't go to the P&Z, it didn't go to the council. If he wants to sell it to a liquor store, and it met the restrictions, he was fine to do it.
Right. But I was just wondering, do we have anything that's coming in?
I was just saying, Sandra, that we got some flack about why we shouldn't have voted for it. And I'm trying to explain that we didn't have a vote on it. That was something that was decided a decade ago.
Well, we've got potential for some retail up on Summit Road, right on the border there with Arlington, but that's not under construction yet either. So
that's true, and that goes to the point of you have to construct the infrastructure for. But we do have the one at Kennedale Sublet and Joplin Road. There's so far there's 4 pad sites, and there's a car wash and an auto parts store coming in there. Also, we have, that just came in, a salon coming into Town Center.
Okay. So, Keith, I got one question for you. So, at the end of 2019, we were sitting at like a 32% reserve in our general fund. As of today, what is the percent of our reserve in our general fund? Do you know that offhand?
Well, yeah, but you don't measure reserves day by day. So as of the end of this fiscal year, we're projecting to be at 12%.
Yeah, 12%, okay.
Mm-hmm.
All right. Thank you.
Sure.
Sandra, more?
I do have something that I want to say. Some people don't like it, some people are not. I think we should go with that, go up to 77% tax rate. But the citizens, they don't trust us. And so what we need to do, and this is, you know, this is my opinion, and I'm going to sleep good tonight saying it, is that we need to go in. If we're going to go up in taxes and we need to get the citizens to trust us, we need to come back and lower Georgia's spending limit. I think that will show the citizens that we are looking after the money. I think they will trust us more if they show that we are keeping an eye on the money that we're asking them to give up. And like Chad said, I know it's a lot of money. I think my house value is like $409,000. It's probably gonna raise my taxes $230 a year. Divided by 12, my bill's probably gonna go up $13. I make $33,000 a year. But as a city, there are issues that we need to take care of. We need to take care of our citizens and we need to take care of our employees. Good employees are hard to find. And as somebody who works in a school district, good employees are hard to find. A lot of people don't think about it. Now they actually really probably don't care, but we can't afford to lose any of the employees that we have, in my opinion. And I'm willing to vote for that 4% increase. But like I said, I think it'll go a long way if we go back and limit our city manager spending.
So Senator, are you saying going from the 50,000 to 25,000 for council approval?
Well, actually, I'm saying go down to 15,000. We need to, I'm telling you, you know what? I'm going to say this. They do not trust us with their money, and that's a big problem. And if we show them that we are watching their money, I think it would be less pushback about the 4 cents. But I'm just one vote.
George, what's your thought of going down to the 15,000?
Mayor, we bounced around with this. We lowered it dramatically. The council went back and saw the operational issues that raised, and you raised it back. There really aren't very many contracts, for instance, that I approve that would be above 15, 25,000 anyway. There are some, but when you start lowering it that low, I mean, we get electric bills that are higher than that. I mean, so how much does the council want to have direct control over to authorize spending that you've approved in your budget?
How much does the city want this tax increase? We have to show the citizens, because they are loud about not wanting their taxes raised because they say they don't have anything to show for it. So, you know, I will say this, I'm not running for council again anyway. So, you know, this is left to the 4 that's here. I'm just giving you my opinion about what I've been hearing from the citizens. And if this is a way to get them to trust us with their money, then I think we should consider it.
So let me ask you this, George. You said there's very few that you actually have to approve that are over that mark, but you just brought up the point of an electric bill. In that scenario, if we reduced it down to $15,000 and we got an electric bill for $18,000, does that mean you're going to come to council to call a special meeting to get that approved?
I don't know how it operates, Chad, because if you say I cannot authorize expenditures in an approved budget that are that low, then yes, it's going to put a burden on the city council. You're going to, I'll get you some office space down here, I guess.
Well, we have a council meeting every month. We get a bill once a month. Why can't that bill be put on that council meeting? Like I said, do what you want to do, but I'm just telling you, if we're going to get the citizens to trust us, then we have to show them that we are looking after their money.
I guess the question is, my question to follow up is, are we asking him to bring to us everything that's over that amount, or that's not in the budget, or things that are not in the budget he should have to bring to our attention?
Well, now, Brian, you have said on many occasions that the budget is a fictitious.
I should have never said that, Sandra.
Yes. So
it is true, though.
I will say it again. From the time I got home today until 5:15, I was on the phone talking to citizens who do not want taxes raised. You know what I'm saying? So if this is what it's going to take, then, you know.
I mean, I can understand that these things could be done on a consent agenda item type basis, but I think the timing of that could wind up getting us screwed, because it would just depend on when the bill is received and when the due date of bills are. And if we don't approve it by the time the due dates come around because we don't meet again, then we are talking about special meetings and publishing those and the cost for publishing those and putting them out.
On the other hand, Chad, you might be able to to be able to do that more effectively now that you have Zoom meetings, and who knows how long the governor's order is going to stay in effect. But if it ends by January, then what do? Have a meeting every week?
I mean, I'm just thinking about the logistic of it, because I mean,
Right.
logistically, if our bill was due before a council meeting was able to have that particular item put on as a consent agenda item to approve it, then you'd be talking about a missed payment.
So
But then
George, what amount will you go for? What do you
I don't
think?
know. I mean, I think you could do something in the ballpark of, if it's not something that's considered in the budget and it's outside the scope of the budget, then sure, we should see it. But if it's keeping the lights on and the things that we've already approved in a budget, then we don't need to see that again. But I mean, if we're talking about, we're gonna go over to Freeze and Nickel and get an engineering study done and it's $35,000, sure, we should see that.
Well, but Chad, what about when the invoice comes in for half of that? Do you want to see that? When
Not
I'm
really.
paying the invoice for a contract that's been approved?
I mean, I would be more concerned with the contract than the invoice, because the contract, we approved it. We know it's coming, it's been approved, it's done. The invoice is just the follow-up on the contract. That's my opinion.
Well, let's hear from Linda. Got you, Linda. You weren't ready for that, but yeah, call on.
Yeah, that's okay. Okay, well, we need to look at our services and programs. I don't really want to cut anything there. I definitely don't want to cut the personnel. I'm not ruthless. And at the same time, we need to be sure and not tax our taxpayers out of their home. And then we have the COVID thing over here on this side of us, and then we have our low fund balances over here. So it's a juggling act. What do we do? Well, I hope that this council can come together and truly say that we've all thought about this. It's going to take everybody, not just the citizens, not just the employees, but all of us, council. I stated the last time, and Josh was not there, and I wish he had been at that meeting. I don't know if he's had an opportunity to see it online yet, but I did state then that I was more in favor of staying with the effective rate, or the no new tax revenue rate. And that's going to be tough to do. It's tough to do the 77 cents. And I really appreciate staff's efforts here with this document that they gave us this morning. I've done one similar for myself, and some of the things were the same, but some were different. Like I did not have on my list any full-time people. I did have some of the part-timers, but they were different than the ones that staff had presented. And I'm sure that there was a lot of thought in there why they had different ones than I did. Y'all know the logistics of what those part-timers actually are doing. That's where we depend on your expertise and the knowledge that you have to give to us. There was one item that's not on this list that I think we could do. And here we go again. It's all small numbers, but it is what it is. It's going to be about a little over $10,000, and that's the overtime in all the budgets except for the fire and police, not including the SRO officers. We can also offer, instead of the overtime, we can give them the comp time, which is still the same. It's still the same. They get an hour and a half for every hour that they put in. It's just not paid right then, but they do have the time. So that's something else for us to think about. I think that's pretty much it. That's the basics. Want to try to look out for the taxpayer. Want to look out for our employees. Appreciate everything that y'all have done. I was the one that also asked about the furlough days. That's kind of like a last resort. But if we have to do that, council, at least our employees, they should know that we care about them. They're having their jobs. They're having all of their benefits. I'm not for taking out that employee assistance program. I think that's good. It's very minimal in the big scope of things. You still have your your longevity, we could look at that even too. But I don't think that's really necessary at this time. Yeah, we could. It would help the long-term fund balance, but that fund balance thing is something that's going to have to take place in baby steps. We can't do that overnight. We have to be real careful with that. The furlough days, if we did that, my thoughts was we could do 2 or 3, and you can incorporate those like around Veterans Day or maybe New Year's Eve, Columbus Day, days that you, if you have a child in school, that child's going to be off anyway. Then that would just be more time with your family. If you've done 3 days, you're looking at about $3,000. So I've just named about $50,000 that, well, roughly, maybe $40,000. It wasn't on. And I'd like to hear what the other council have to say about that.
Chris?
Thank you.
Well, I guess I'd like to ask Linda a couple questions. Linda, you're in favor of the effective tax rate, and you've named $50,000 in cuts. So you're in favor of drawing the fund balance down $500,000? Because if you go with the effective rate, that's what you're supporting, is a drawdown of $500,000 next year. We're one catastrophe away from this city being bankrupt. One tornado, one flood. I mean, that's what the numbers say. 591 minus 50 is 540. So you're willing to draw the fund balance down $540,000 and then face the budget in a year.
The difference between the 77 cents and the effective tax rate is 139,000. So, you know, that's what you're talking about, the difference in those two columns.
Well, you said you were in support of the effective tax rate. And according to the chart that Lakita presented us,
Right, I'm looking at it.
the effective tax rate draws the fund balance down by $591,000.
And the other one's 452.
Okay, well, where are you getting that money from?
So
Where are you going to get?
That's just a difference of 139. That's just a difference of 139,000, and I just gave you that. I just gave you where it was coming from.
You gave us 50. So you're willing to draw the fund balance
No,
down?
No, I didn't. I added 50 to what was already presented to us.
So you're wanting to cut?
Sorry.
I don't know what you're willing to cut. You said 50,000 a minute ago.
Okay.
So,
On George's list, the green highlighted, the 2 top green highlighted things, those, and none of the full-time employees and none of those part-time employees that's listed on there. But for sure, the 2 green things, the overtime, all the travel that's on there, that's 23,000. You've got the list. You can go down and read it. George just went over it all.
That's still a drawdown of $400,000. You're willing to draw the fund balance down $400,000?
Now that's what was proposed, is drawdown of 400,000.
Well,
the staff has proposed 400,000 drawdown. I didn't. They did.
Okay, then what are you supporting as a drawdown that you'll live with next year? Because you haven't named $400,000 worth of cuts. You've named 50,000 and maybe another 50 from George's recommendations. I'm just very confused as to how far down you want to draw the balance next year at the effective tax rate.
Okay, good. This is healthy conversations here. George's spreadsheet, the one that was submitted today, was like, what was it, 600,000?
Sure.
600,000. Okay, and then let's take off the full-time employees. Somebody got the math, the calculator there?
It's 191,000.
There's only 191,000 on that list that is not employee positions.
So if we do everything that's not employees, we're saving, to make the math easy, 200,000. At the effective tax rate, we're still drawing down $400,000. So where are you getting?
What was proposed to, though, Chris, was 452. I'm staying within that realm there that was proposed of a drawdown of 400. I'm
So
saying within that was already proposed. That's what is being presented to us.
So you're willing to
So
spend $100,000?
I'm willing to what now?
You're willing to accept a drawdown
I'm
of
sorry.
$400,000?
Well, if you're going for the proposed rate, you are too.
I didn't say what rate I'm going for. I'm asking because you said you were in support of the effective rate. The effective rate is a drawdown of $591,000. So if we take all of the items that are not personnel, that's still a drawdown of $400,000. So where are you going to get that $400,000, or are you willing to do the drawdown? That's my question.
I think
it would actually be less than the.
Linda, you said that you didn't want to do it all. You said you didn't want to do it all in one big chunk, right? Step by step. Right? You
Yeah,
said
I'm sorry, you cut out.
You said you didn't want to do it all in one big chunk, right? That you're willing to take it year by year as you work it through. You weren't proposing the entire year be back down to zero.
Wasn't proposing. When I said go all at one whack, you talking about the last meeting when I said that?
No, you said that. You said again this time you don't want to go at all whack. So you're really not arguing. You're not arguing that we go to zero this time around. Right? You're saying we got to take steps.
Yeah, I think, Mayor, what you're asking her is, Mayor's saying you're not saying go all the way to zero drawdown this year. That will take a period of time.
That is correct.
So you're willing to draw the fund balance down some. The question is how much, and that's Chris's question.
Yes.
Okay. Well, then I guess maybe that's a question for all of council. How much of a drawdown are we willing? Because if we accept what's being proposed to us, the proposed is 77 cents with a $452,000 drawdown.
That is the amount of the drawdown that's in the proposed budget in order to stay below the rollback rate of 77 cents. But recall that the discussion and my recommendation was that is the proposed budget that's been filed, but that it keeps the fund balance at only 6.3%. And I recommended that you have discussion and consider a rate over that rollback rate of 77 cents. And I think up to at least 80 cents to try to get that fund balance this year up to at least 9%, which is still half of what our stated policy is.
And George, didn't you strongly recommend that we consider the 80 cents to try to begin to build the fund balance?
Yes, I do. Yes, I do. Absolutely. I mean, and I know that that's a huge, that's a big increase and a big pill to swallow. But as George stated, it is very, very important for us to get back to what is acceptable within our own policy with our fund balance. And so the 80 cents is going to give us a new baseline. And it's also going to give us the opportunity to not particularly have to explore such a detailed list about other things, about cutting future programs, cutting staff and things like that in future years. It will just altogether give us a new baseline and kind of ease the worry of fund balance to this level. So I do really wish that the council would consider the 80 cents.
Well, I guess my concern, Mayor, is if we do the non-personnel cuts, and I think Chad's mentioned this already, that's a 1-year Band-Aid. Next year, Linda and whoever's on the council will be sitting here having the same discussion, trying to figure out how we're going to get out of a 6% fund balance, assuming that we don't have a disaster. And hopefully we don't. Hopefully we get through all this and we're fine. you know, we hired Lakita, and Lakita is the expert. She came in with fresh eyes. She came in from another city with experience, and she has looked at our expenses, and this is her recommendation. And although it is a difficult decision, it's very hard for me to go against Lakita's advice, because that's why we hired Lakita. And Lakita, you can double check my math. I kind of did a little math. If we went to the 80 cents, a $250,000 house is about $165 a year,
Yes.
give or take. So I look at that as, you know, it's a couple of trips to Starbucks. But what do I gain from that? I get to keep our library open. I get to keep our senior center functional once the COVID crisis is gone. We can build the foundation that Lakita has discussed. We cannot lay off our team, which Sandra has pointed out, good people are hard to find. And Danielle and the Chiefs have done a great job building our foundation. And I have had a couple of people tell me that, no, I don't want to pay more taxes. But I've also had a number of people say, well, if it's $10 or $20 a month so that I can keep my library, or that the park gets mowed, then I'm willing to pay that.
Let me just, Chris, before you start on that, we need to remember that property taxes it's the gestalt. It's all of it. It's about the city taxes. It's about the school taxes, county, TCC, and the hospital district. The school district is actually going down 2 cents level because the state is mandating they have to drop their property tax 2 cents. So I just want to make sure that when we talk about how much money is going to be increased, you're also saying it's going to be, overall, you may see a balance, might see a little bit more, you might see a little bit less. It's all about, when you talk about taxes, and I think a lot of people don't understand this, is that it's the city is about 25% of that, the school district's 50% of that, and the other entities are 25. And so you really have to take a look at what the tax pie is and make sure that you don't, just like if we raise it 5 cents and the county raises it 5 cents and the school district raises it 5 cents, it's catastrophic. But what are the other entities doing at the same time?
Right, and the school passed the tax decrease, correct, Mayor?
Yes.
So it went down like 1.6, 1.7? Did they pass the full 2?
Yeah.
So I guess that's my concern, is that I want to trust Lakita's judgment, and I don't want to be having this discussion, if I'm fortunate enough to be here in a year, talking about the same things every year. And I know it's a burden, but my feeling from the people that have messaged me, have emailed me, that if it's $10, $15 a month, that they are willing to sacrifice that in order to keep the services that we provide.
And I just wanted to make sure that everyone was clear about what the exact amounts are. So this year, with the 2020 tax roll, the average home value was around $221,000. And if we go to the 77 cents, that's adding $78. Okay, and if we go to the 80 cents, that's $132 on a $200,000 house. So from the 77 cents to the 80 cents, you know, that's what we're looking at, from $78 increase or either $132 increase per year.
How does that stack up to the total tax bill according to what the county's charging and the city's charging and the school district charges? Does it go up $130 or does it go up $60 because of certain reductions on the other side?
Yeah, I have not looked at the overlapping rates, but Lakita may have, but I have not looked at the overlapping jurisdictions tax rates.
I guess my final thing to say, Mayor, is that I know that we have discussed, or we have at least seen communication that maybe we could look at some alternative ways to funding the equipment for our fire department next year. that's going to determine our interest rate this budget. If we draw our fund balance down to 5-6%, what kind of a bond rate are we going to have next year when we go and try to fund the new fire truck that we have needed, or the new ambulance, if we continue our ambulance service and that's the most best way to do it, and we go to fund that ambulance, what are we going to pay if our fund balance is bottoming out? We're going to end up spending more, and I'm just very concerned that if we get down to a 6% fund balance, again, we're one disaster away from a budget financial crisis, maybe a bankruptcy. And that's just being real. That's not being scare tactics. I mean, if you're down to, I look at the fund balance, if you're down to 16 days of expenses and we had a flood, what would we do? I would rather that we be in a position to take care of our citizens, take care of our employees, and not have this discussion every year about who we're not going to let go.
Well, let's keep in mind, we won't go bankrupt. What will happen is we'll go to a volunteer fire department. We'll go down to one police officer, and all those services will suffer. That's what happens.
Sadly, that's a potential outcome. Yes, sir. You're correct, Mayor.
Josh, and I'll save Chad for last. Sorry, Chad.
I got a question real quick for the city manager back on the last slide. Which, because my deal's cut off. I can only see like half of it.
What do you want to see?
Here was permits and inspections, the outsourcing that.
I'm sorry, Josh, would you say your question again, please?
The outsourcing for the permits and inspections, which one was that?
Well, there's an item on there called Special Services Community Development, and we're reducing, this line is to reduce that budget by $5,000. I think the total amount in that line is $45,000. This would take a piece of that, and that money is there primarily to pay for the contract, the contract that we went into to pay for building inspection and those things, in order to save like $100,000 we were paying for that in-house with just one employee.
Right. Okay. I couldn't see it very well on my piece of paper, so I needed to look at that.
That's one of those things where if we in fact had to spend it and it wasn't there, we'd have to figure out a way to find it, because those are services that we've just got to perform as a city.
The total number was based on the history of, since we've had them on board, looking at approximately the monthly cost for those inspections. So the $45,000 is approximately what we're spending now, with just a little bit extra because we know we're about to get Magnolia Hills in with 92 plan reviews and inspections. So that's something George said that we have to do.
Yeah, that was my question, because I know the importance of it, and I know it's critical that we have them and what we got to do. But some of the other things on here that I don't agree with, of course, is special events. I think it's very important that our town has special events to, like you said, have a sense of community. The furloughs, as a city employee myself, I'm totally against furloughs. I think it sends a bad message to the employees. And what else? If we don't do the employee appreciation dinner, heck, I'll pay for it. We'll do one. Another question I had was, since I had to leave, what was the decision on the ambulance quote? So we're moving forward with that, or what?
We're just going to do an RFP, but it wouldn't be for this year anyway, Josh, because it'll take 3-4 months. It would be something we'd look at next budget.
Did we have a majority that wanted to look into that, or?
Yeah. Now, to be fair, it was a rough majority. There were a few that said, hey, I don't think I want to do this, but it's okay to get information. But you'd have to show me a lot for me to change my mind.
I guess that's just the questions I had. Do you want my stance on what I think we should do tax or what?
Yeah, give me your stance there, Josh.
I think we need to just go back to the rollback rate of 77 cents. That's where I'm at. So
All right.
I kind of came in here late, so I didn't really get to hear, especially with this loud machine behind me. I'm having a hard time hearing, but
My computer cut out. I didn't hear what you said. Could you please repeat it?
my suggestion is to go to the rollback rate of 77 cents.
Okay, thank you.
Mayor, just as a point, just a reminder, we are scheduled for your hearing on that on September the 8th, the hearing on both the tax rate and the budget. So.
Well, let's hear from Chad.
All right. So it's an ugly situation all around. You know, I'm in the position myself, personally, as a citizen outside of being a council person, that I have a business that has pretty much gone under because the event world is dead. I've lost almost $100,000 in contracts for all sorts of things. So when we start talking about, oh, it's just another $224, well, I'm looking at, well, I still have bills that I don't have money that I'm not going to make. So for me, it's all right. So how much can I get from my house? That's literally the situation I will be in with the tax increases. I'm out. I have to get rid of my home. It's a harsh reality, and there's going to be a lot of us that are going to be facing this reality because we've lost our jobs, we've lost our income, we've lost the ability to do that. So while it's really easy to sit here and say it's just another dollar or two, it's just another Starbucks or latte, I don't know, you know. And Brian, you mentioned going back to a volunteer fire department. That, you know, you may say that sounds like a great idea. We could save money doing that. Well, guess what? Your insurance rate on your home is going to go up enough to cover the cost of the other side of that.
Right.
You're going to have a homeowner's insurance increase because your ISO rating just went out the window. So you're going to get, you know, 15% bump in your homeowner's insurance rate. For me, that's probably about the cost of this. So again, damned if you do, damned if you don't. I don't know. I have a real hard time voting myself out of my own damn house. So, and that's a harsh reality. Is if I vote to increase to the 80 cents, the for sale sign goes in my home next week. It does. The day we have this election, I put a for sale sign in my home. There's no getting around it. I'm that far under on my expenses year over year for this year that I don't get an option. And I'm literally trying not to cry right now because it's that serious. You know, I have one business. I don't even know if my Santa business will be open if that happens this year. So if my Santa business doesn't open up, I'm real screwed. So,
hey, Chad, and you don't see any change in your business model for months, do you?
No, I haven't even gotten booking. My normal Christmas holiday bookings that I usually book by August haven't happened. My annual big events that I do in March, April, and May haven't even been a discussion on the forefront. I have continuing contracts with some of these big corporations that are year over year, but as long as they're not allowed to have these events, those contracts are worthless. I had to go back and redo my 2019 taxes because I had to refund so much money in 2020 that it affected my 2019 income rate. So it's crazy. So I have a hard time voting for any tax increase, and it sucks because that's why I'm saying we've got to find the money. Otherwise, I'm out. I'm literally out. And I'm not saying that something can't happen to change my mind on that or to figure it out, but there's a lot of people going, okay, well, my rate goes up, and so I have $200 I got to find now. That's $12 a month, but I'm still $600 a month short in all my bills. So who gives a shit about $12 because I'm still 600 short.
A PG-13, Chad. PG-13.
I know emotions right now, and it's tough because I'm literally looking at moving, and I don't want to. I hate moving.
So what's your
Change my
recommendation?
mind. that's like I say, change my mind. Because right now, I think we as a city, we have some really ugly options we can take. They may not be pretty, but at least some of us can stay living here.
So what's your recommendation, Chad?
I don't know. I mean, at this point, I really don't know. And that's the hardest part about this, is if you look at this budget and we're talking about, if we did everything on George's list here, and we're not talking about cutting anybody's, dollar amounts. But again, remember, employees aren't getting raises, firefighters, EMS, you're not getting your step increases, and you're definitely not getting raises next year. So we're asking our employees to take reductions because cost of living sure as heck went up more than 2%. So they're not getting that. So technically they're getting decreases in their cost of living. I mean, we'll just be right back in the same boat, having the same stupid conversation with nothing there. So either we need to put all of our effort in retail, or I'm serious, like $1 million right now, year over year. We're going to cut people $1 million of people and be done with it, because what's it going to be next year? Oh, we got close, but now we need 83. Oh, we got close, but now we need 84. I mean, at some point, us as the homeowners, we just have to go, we can't afford this. We can't live here. And I'm telling you right now, that for me, I'm on that ledge. I am literally on it. Now, if my businesses were going and I was making money, $220, done. But I mean, I haven't been able to give to the charities that I normally give to. I mean, we ran out of money to make masks, all that good stuff we were doing. It's just, we had to turn it off because the business went up right. So it sucks. I can't be involved as I want to be, and I can't do the things that I want to do, and I can't be the person I want to be because I got to give it to the government who thinks they know how to do it better.
Can I say something?
Yes, Sandra.
I think we waste a lot of money, and even though it might be a small amount, it's still a waste. Open records request. I mean, we spend so much money on attorney fees, going to the Attorney General's office, sending letters to the citizens that's requesting the information. Every single time. Why? I mean, just give them the information. If they want to know how much money we have in a fund balance, give them the information. Why does it have to go to $50 to the attorney, another $50 for him to send a letter or an email, and then another one when they respond back, and then another $50 when they respond back? And even though it's a small amount, that small amount starts to add up.
George?
Mayor, I'd be happy to visit with Sandra or any council member about that. We have to comply with the law on open records requests, and we get a lot of them. And we can divulge some information, and we have to deal with each open records request as it comes in. And we have to be able to understand what the question is. But we can't spend a lot of time creating documents that are being requested. And the money you're talking about us spending, Sandra, is to make sure that we're providing what we're required to provide without exception.
Well, let me say this. I saw an open records request, and none of the information she requested was sent to her, but what was sent to her was an email that I sent to you and Brian, which she did not ask for. So
Sandra, I would be happy to discuss that.
With the open records request. So what I'm saying, if it's something simple, are we sending that to the attorneys or not? Or we're just sending that information to them? Or are we going?
Sandra, on the one you're talking about, we've had the attorney, the city attorney, involved in that from day one because of what the request was for and how difficult it was to respond to it, and the fact that the response was never accepted by the applicant. And you're talking about a situation that I'm not free to just go into all the detail on, but you're getting one side of a picture here. from somebody
Well, no, George,
doesn't provide.
I saw all the emails myself. And like I said,
Okay.
what she requested originally, she got none of it, but she got an email that she didn't request that I sent to you and Brian.
I
So
think there,
I don't understand why.
I think there was one document in that original request that she had not asked for. And that was probably an error, but we didn't have most of the information she was asking for in the form she was asking. And
So
that's,
let me ask you a question. How could our city secretary send something to her in an error that she did not have? So who gave her?
no, Sandra, I'll be happy to talk to you about this.
Because I'm still saying
privately.
we waste a lot of money.
Well,
let's have that conversation. If you guys want to have that conversation and maybe come out with something, that would be great. Because I think we're all restricted on what we can say here in terms of the request itself. So maybe this isn't the best place to discuss it, but it needs to be discussed. So does anybody else have anything? Let me get my opinion on the budget. I'd like to see what the total tax burden is on the residents based on what, if any, tax increase at all. I'd like to see that. And I'm with Josh, and I'm going to say real quickly, the policy of furloughing, the policy is ruthless. I mean, especially for our employees. Our employees haven't got raises many years. We've asked them to wear many hats, and now we're creating some sort of Dickensian work environment for them when their morale is low as it is. And to furlough them is going to cut their pay when they're not getting a pay raise, and we're asking them to do more. And I don't see it saving a whole lot of money. I really don't. So I'm with Josh on this about furloughing employees, but I'm also well aware of that you're going to have to have some cuts someplace. That's true. Linda's right about that. You're going to have to eliminate some things. And when you eliminate things, that means grass doesn't get mowed as fast. It means you don't have trunk or treat. It means all that sort of stuff that's going to go with it. And that's up to you. And I think what George wants to tell you is that you have to post by when, George?
I'm sorry?
You have to post by when on the tax rate?
No, we'll have a notice in the, that will be posted, I think September the 2nd for the hearing on the 8th on the tax rate. We posted the notice for the budget today, I think, or it will be out this weekend. And we're posting that at 80 cents just to keep you all's options open.
But it means you could also adopt a 73 or a 75 or a 77.
Well, whatever you post or whatever we place that notice in the paper for sets a ceiling on what you're able to do. So we're just trying to set it so that you've got the option to go to 80, 77, 75, 73, whatever you decide to do following hearing from citizens at the public hearing.
So it sets the max, not the minimum.
Yes.
Chris?
Well, I guess what was the question? We've had so much.
I'm saying that we have to set an idea on when we post this, we have to have a max. It's not what we have to adopt. We can adopt any number below that, but what should be the max that we'd ever even consider?
I think we should at least post what the finance director's recommending, and if we go for lower, then we're fine.
Chad, what are your thoughts?
It doesn't mean we have to approve that, but it gives us that option to where we don't have to go back and repost and delay the process and call special meetings.
I mean, it's an intangible product at that point. It doesn't matter what you put on paper.
Right, it's nothing what you put on paper. Josh?
I agree. I think we should post the 80 like Nikita suggested, but of course that's not the direction I'm going. But
Yeah, and that, I mean, like I say, if the direction's 77, we can go to 77, 75. Yeah. Linda, your microphone's on, so don't turn it off.
Yes,
It is. Of course, unlike Josh, you know the direction I'm leaning towards,
Right.
and I would say post 77 cents, the proposed.
Sandra?
Go ahead and post the 80.
All right, so George, you got 4 for the 80, 1 for the 77, post the 80. Keep in mind that doesn't commit you to 80. It commits you just that you will go no further. You could go to 73, 75, 77. But I would like to see at the next meeting what the total tax rate is, the burden is from the county level, because I think they're lowering theirs a half cent, and the school district level. What's the impact on the average household when you look at the tax base? I have to see that.
Okay. We can get that.
Because we don't live in a silo.
I'd like to see that too, Lucky. I think that's a great suggestion for us to look at the total tax burden on everyone.
Sure.
And everyone else is set there right now except for us. Is that correct?
No, I don't
know
think
if the county has.
I
or
don't
not.
think the county set
The
there.
county has it, but they proposed their budget in the paper.
The
It's in
school
the-
district has a different fiscal year than we do. They had to get theirs set.
But if all of the entities haven't voted yet, we can do the calculation based on what they proposed.
Yeah, I'd like to know what the total tax rate is, because when we say it's $170 increase, is it a $170 increase, or is it a $30 increase with all the other tax rates going down? That's the question.
We'll get that to you as soon as we can. Just
Well,
as we
what? Let me throw this out here about the fire truck and the ambulance. Are people okay with using part of the intended savings from that we had talked about next year to replace those two items that need replacing?
Kind of like what George suggested as far as the CO. Is that what you're talking about?
Yeah, okay.
I agree with definitely, using that CO for the ambulance and then restructuring it for the year of the vehicle.
Chad?
I mean, I guess this gets us back into what's that add to the bottom line debt servicing year over year?
What I'm talking about and have suggested is we've had several meetings now where we're talking and have advised the council that you can, over the next 3 or 4 years, issue up to, I think it's $16 million worth of
14.
debt, $14 million worth of debt without having a negative impact or raising the debt service tax rate. I'm only suggesting that we use a piece of that to buy the ambulance, and then in the next year or two, if we're in line to replace a piece of fire apparatus that will be much more expensive than the ambulance, that we take those two pieces of equipment and issue debt to purchase those without a tax rate increase for debt service, and get those purchased without making them part as a capital purchase in our operating budget.
Sandra?
I agree with Josh and George on the CO.
Linda?
Yes, agree.
I think that's everybody there.
I got a quick question.
Shoot, Josh.
Do you know when the census is going to come in, the totals? Do you know, like, the timeline?
I don't know that. Leslie, do you happen to remember when they're still doing the survey, so I don't know when we'll get.
I saw Thelma the other day, and she's still out knocking doors.
Really? Okay.
No, they're still in the physical knocking on doors phase of that. But
Okay. Thank you.
I'll look and see if I can find a timeline and I'll send that to you. And
I think there is a date that has to be reported to the president.
yeah, there is. I can't find it right this second.
I can tell you that it has to be reported by December 31st to the president. And then you're probably looking at the next couple of years before you will actually see the local data fully roll out, to answer your question.
Okay, so my next question is, do we need to have another meeting before the September 8th meeting? Would you like to see some more information that we can find? If there is, give George, you don't have to make a decision right now. Give George some questions. And then if we see enough people say, hey, I'd like to have another meeting, we'll have another meeting next week before the 8th, a special meeting to discuss your questions and see if we can get your answers.
If you provide us with any additional questions, we'll respond to those as quickly as we can, and we'll respond to all council members with any responses that we have from individual council members. So we'll get it to you. And obviously you're only about 12 days away from that public hearing. So I've made a couple notes for some information we'll put together for you and get it out as soon as we can. And then if you decide you want to have a meeting, just let me know that.
Do you want us to email you what we might not want to see cut out of here versus cut, so you can kind of give us a better idea to include that at a later date?
If you've got something, are you talking about the spreadsheet I sent you today?
Yes, sir.
If there's something on there that you believe we ought to cut from the budget, then let me know what those items are so that I can share that with the full council.
Right.
But I don't think I've heard anything specific on here that's big dollars at all, that I've seen a consensus of, except that I'm taking away from this. We're going to do the reduction in the health insurance costs. We're going to do the reduction or make the migration of the senior center management over to the library staff. And we're not going to be cutting any of the employee positions. So I don't think, and there are going to be some of these things that whether we cut them out of the line item budget or not, they're going to be savings in the budget that will go into the fund balance, because there are going to be some of this travel money that simply can't take place. There's going to be some cleaning of some buildings that we don't have to contract for because the facilities are closed. So any of those other amounts that simply can't be used, and we look for those all the time, will wind up being enhancing the fund balance.
Well, and Josh, while you were out saving lives, one of the things that we were talking about was that you're not going to be able, we probably won't be able to do trunk or treat or the Christmas tree lighting simply because of COVID. And so that money will go back into the fund balance, not spent somewhere else.
Right, but I would also like to see it not cut, because if it does get lifted, then, you know.
That's right. We wouldn't cut it, but if it doesn't get spent, we'll put it in the fund balance.
Right now, I'll provide you with a new summary. Let me rephrase that. Lakita will provide you with a new summary that cuts those that $40,000 at the top of that list, and anything else that we just determined between now and the time we get that list prepared that needs to come out. So you'll see a new total before you go into your public hearing on the 8th.
And Josh, let me give you the simple answer to your question. Yes, if you see some things in there, email him. He's a little bit more long-winded than I am. So yes, if you see some stuff, email it in.
All right, thank you.
Thank you, Mayor.
You're welcome. Any other questions? Well, this is a workshop, so I don't think I have to have a motion to adjourn. Is that correct, Leslie?
It's up to you.
Well, I'm going to declare this meeting adjourned then.
Deal.
All right. Thanks, everybody.